it's my pleasure to introduce Dr. Meenakshi. She's our next speaker, and she is well known in ophthalmic education circles in India and internationally, and it's really a pleasure and a privilege to have been her student. She's recently stepped down as Director of Academics at Shankar Nethralaya. So her topic is on selecting your fellowship, and she'll be restricting herself to the Indian fellowships and what one should be looking out for in the fellowship that one is applying for.
Good morning, and thank you, Dr. Devendra. He was one of our star students, so it's an honor to be a part of his instruction course. So I'm going to talk a little bit about how do you go about selecting a fellowship. How many here in the, first let me thank the audience for being here with us on a Sunday morning, that too very early. How many of you here are looking at further training, fellowships, in the audience? Can I have a show of hands? Okay, great, thank you. I hope this will help guide you. So I'm going to start off with a little story. So many years ago, there was a young man from a small town in Karnataka. Arrived by train, that is the Chennai Central Station, and joined Shankar Nethralaya for post-DO DNB. After interview, those days there was an interview. But he had his dreams. He said, you know what, I'm going to finish, I'm going to go back to my small town in Karnataka, I'm going to establish a hospital, I'm going to take care of patients who cannot afford. And we were very impressed in the interview that this young man has such lofty ideas of taking care and giving back to the community. What did he do after DNB? He did a vitreoretinal fellowship. Wonderful. Then he joined even as a vitreoretinal consultant. But then, after about 7 or 8 years, he got a wonderful opportunity in the Middle East and went away. Now, you may wonder, is this success? I mean, success because he did really well and now he's got a really cushy job somewhere, earning well. Or he never made it to his dreams. He never went back home and did what we thought is what we were training him for. So anyway, there are many ways to look at it. But let's come back to the topic. When is a good time to do a fellowship? Especially if you're a lady, you have just finished your residency, perhaps parents, or you yourself have decided to get married. When are you going to start a family? Who's going to take care of your kids? So many questions are there when you decide to study further. So what is the ideal time? Is it soon after PG? What is the advantage of doing it immediately after the PG? Because you can crack the MCQ or the interview because your knowledge is still fresh. There is no break in surgical training. You can, wherever you leave off in your PG, you continue in your fellowship. Your faculty still remember you, your teachers still remember you, they are likely to give you good references and, even pick up the phone and call and say, this person is known to me, very good, yeah, excellent candidate for your fellowship, etc. But there is no time for a personal life at all. In fact, our fellows, when they used to come back and say, I'm getting engaged, I'm having my wedding, there is honeymoon, first Diwali, first Karwa Chauth, whatever, no leave. We just cannot give leave. So that is the disadvantage of doing it right away soon after PG, just sailing into the fellowship. What about if you take a break and work for a little bit, maybe even have your family, and then decide you want to do a fellowship? What are the advantages of that? Well, you all are aware there are many programs where your surgical training is far from adequate. And so this break may give you a chance to remedy that. You may be able to work in charitable hospitals, you may be able to do short-term fellowships to improve your surgical hands before you go to especially surgically intensive fellowships like vitreoretina or oculoplasty. So it may also help you decide what you like and what you don't like. You may, go as an observer. For example, you might have gone to a medical college where they don't do any oculoplasty except DCR. So, but you have a feeling you may like it. You may even be able to go as an observer to a larger institute and see if this is your cup of tea before deciding to apply. And, well, for us women, you may decide to have a family, have a couple of babies, why not? And then even earn some money. If you're going to be working for a few years, you improve your bank balance, and then because your fellowship stipend is going to go down again, and so this gives you a chance to remedy that as well. So that is about timing, when to do. How about where to do your fellowship? So what are our choices? It could be a small practice. Many fellowships are offered in small practices, or it could be in a large institution. Pros and cons of each. So when you look at a small practice, you can often continue to keep in touch with comprehensive eye care. What I mean by that is if you go to a large institution, and if you, for example, are doing vitreoretina, you only will do vitreoretina. You will hardly seldom be able to do comprehensive fellowship, except one or two institutes where the models have changed recently. You may even be able to get more surgery in some smaller places, especially if you have a good rapport with the chief of the place. Like a big institute like Shankar Nethralaya, I know there are fellows crib about call duties. There is, eye donation call, there are ward calls, there is OT call. In a smaller practice, there is less likely to be that many number of calls. What about a large institution? The fun of a large institution is, for example, if you say vitreoretina in Shankar Nethralaya, I think there are some 16 consultants. So imagine the number of points of view. You will get something about, somebody is doing only retinoblastoma, somebody is specializing in diabetic vitreous surgery, somebody is specializing in ROP. So you will really get a wide spectrum, wide points of view when you train in a large institution. The patients also tend to be more complex. You will see a wide spectrum of patients, from the very simple to the referred patients because it's a tertiary care center. You also have the fun of multidisciplinary interactions. Your retina patient who has, say, a bad glaucoma, you'll be able to see how fantastically this is managed if you are in a large institute with many disciplines. And many of them have junior residents, so you will have a chance at seeing if education and teaching is for you. But there are more calls, for sure. Okay, so that is something to think about. We have covered when to do it, the fellowship, and where to do the fellowship. Now we move on to which subspecialty. Now, Dr. Milind Nayak from LVP, I think this is in his website, how to choose your ophthalmology subspecialty, and there is even a version 2.0, and it's more a humorous take. It talks about if you are socially awkward and don't like to see patients, then you should do community ophthalmology. I don't agree with any of this. Or it says if you love children, you do pediatric, and if you want to run away from them, you can do the rest of them. I don't think that is true, but a lot of it is humorous. It does give you some kind of roadmap or guidance, but I'll tell you a little bit more practical ways to decide which fellowship. Before you even go in to decide which fellowship, prepare to decide. What I mean by that is exactly what you're doing. Go to big conferences, go to many sessions, listen to the stalwarts, listen to paper presentations, go look at the posters and videos. Decide for yourself, are you getting a kick out of this specialty? Is this something that's making you smile? Okay, so do this before you even start deciding. Watch videos. There are so many surgical videos, free videos on YouTube, teaching videos, to see whether this is your cup of tea. You can also, like I said, go hang out in the clinics. Ask to be an observer in institutes, go spend a week in the OT, and now that COVID is hopefully pretty much gone, I think observerships should reopen, should be able to go and observe. Webinars. I think we've all been inundated with webinars during the COVID. So many webinars, recordings are available. Go look at the recordings. See if this is what you like. Don't do it because you don't know what it is. I've had people apply for pediatric ophthalm and squint fellowship because they never did any squint in the PG. I'm like, how do you know? You join and you hate it. You hate holding the prisms. What are you going to do? Run away, is it? So the way you solve that is to what I listed before, to see whether this is your thing. Next, sometimes you have to decide about your fellowship depending on where you want to practice. This is a small little place called Karur in the middle of Tamil Nadu, population of 10.6 lakhs. You may not do well if you're going to do aesthetics, you know. So you want to practice in Karur, that's your hometown, please don't do an aesthetics fellowship. You may not have patience. Maybe you come from an ophthalmic family and you are the last person who has to do the vitreoretina to fill the rest of the specialties. Then somebody has made the decision for you. So don't even fight it, it's okay. What about finance and practice style? You like really big money, don't do pediatric ophthalm. You love comprehensive, do small fellowships. Don't waste time on doing long-term fellowships. Do little fellowships. You want to serve the needy, maybe refractive is not the way to go. And if you're passionate about giving vision to your patients, that is your thing, then maybe plasty, oncology, definitely only plasty may not be ideal. If you don't like children, it doesn't rule out peds. If you like doing charitable work or working in the community, comprehensive may be a better option. You don't mind long hours of surgery, then these are the choices. And if you can deal with morbidity and mortality, then oncology is good. And other fun things is you have work with support teams like oncologist, ENT. If you do cornea, you may need support of an eye bank. If you have family commitments, don't do anything that is exhaustive. Before the interview, work on your CV, make sure the spellings have all been checked. And if you're going to an institute, see who published what in that institute. Read up before you go. Read up recent advances, which are always asked in interviews, because you don't even know what's happening in your field of interest. Then, how do I know you're going to be a good fellow? That is my approach as a teacher. And make sure you're well-dressed and groomed, rested, and you go to the interview on time. And have a plan. Improve your surgical skills with short-term fellowships, as I already told you. Make sure you have answers for who is going to take care of your child, how will you deal with your spouse being in a different place, how will you deal with cultural adjustments. Be sure you have thought about all these things before you go in. So very quickly, once again, a little story. Why did I do pediatric ophthalmology? I did my residency in the University of Louisville, and then I developed cervical spondylitis. So my mentors told me, don't do anything very intensive surgically. So that ruled out vitreoretina, etc. And then I had to choose where to go for the fellowship. And I was offered Bascom Palmer, but it's in Miami with a lot of crime. And I was going to be I was offered in Chicago, again, a lot of crime. And I saw graffiti when I went for the fellowship interview, and it kind of scared me. I had 2 little kids at that time. So I chose University of Iowa City, a lovely college town. That's how Iowa looked when I went for the interview. But it was okay, it was only for a year. And so I did my fellowship from University of Iowa. So there may be other considerations how you decide where you want to do your fellowship. My little kids who are now grown and who are parenting me now. So I'm going to end with a verse. I believe it is the fashion to follow your passion, even if it leads you astray. Don't get on that ship called fellowship till you have thought your way. Family comes first, then quench your thirst for knowledge if you may. Advice I will give, love, laugh, and live. Be happy, end of the day. Thank you. Thanks, Devendra.
Lovely. Lovely. Thank